This is a condition that usually starts with things like fever and feeling lethargic and unwell. It often then presents with skin rash, particularly a pustular skin rash, and this is normally what's infectious for people when they get it. Now, most cases when they occur are mild. A few people do get severe disease and need to be hospitalized, and a very small proportion of people die. Although I have to say, in the current outbreak that's occurring, there have been very few, if any, people who have died from monkeypox.
So how significant is it that it's now been declared a global health emergency? Does it mean that we should all start worrying?
I don't think there's a need to worry for the general public. I think certainly for public health practitioners, there's a need to worry because this is an unprecedented outbreak that we've had and it's not yet under control. But I don't think it's going to spread into a generalized epidemic.
So now we've had this declaration. What kind of extra help does it unlock?
Well, what we have here is we've got an unprecedented outbreak that's widespread in many countries, and it would benefit from increased international cooperation. So what I really hope is that it means countries will be working together to combat this. One of the really difficult elements with this, something Dr. Tedros mentioned, is stigma, because this is a condition that's mostly occurring within men who have sex with men. Now, that stigma varies in different countries of the world, and in some, it's really very severe, that stigma. So if we can get better international cooperation here and people are dealing with this on an equal footing, that will be very good. The other thing I'd like to see is this is an outbreak that has been occurring in Africa for around 20 years and the number of cases steadily increasing. And this, if this unlocks increased attention to the disease for control within Africa, that would be a good thing.
Do you think that the global health community has, to a degree, taken its eye off the ball on monkeypox? Obviously, it's had coronavirus to deal with, but do you think it's been taking monkeypox seriously enough?
Well, this is a disease that normally occurs in a few people within Western Central Africa. Very occasionally, it gets outside Africa in travellers, and our experience up until this outbreak has just been one or two cases occurring. When that was the situation, then I think for the global community, this is an issue, a problem for Africa. But we have to remember that this is a condition that is not as serious as things like malaria and TB and HIV, and ministries of health in African countries are much more focused on dealing with those.